Hollywood actor Bruce Willis, who is known for his stellar performances in films like Die Hard, Unbreakable and so much more, has recently announced his retirement from his acting career because of his diagnosis of the disease aphasia. This disorder has been impacting his cognitive abilities and hence the family announced this decision of retirement. But a lot of people since then have a lot of questions with regards to what exactly is this disorder. What is aphasia? What are its symptoms, its treatment? Is it even treatable or not? If you are someone who has all these questions, then this video is for you. Let's hear from the expert herself.
So aphasia is a disorder of language. It's a neurological disease. So basically in aphasia, patient has a difficulty in understanding either language which we are talking to the patient or understanding in written language. So patient will have difficulty in expressing his words or will have difficulty in understanding what he's been spoken to. So there are different types of aphasias. One type of aphasia is in which patient will have difficulty in delivering his speech. So there will be a difficulty in the flow of speech. So patient will have a slurred speech. The other type of aphasia is a difficulty in understanding what he's been spoken to, which is a difficulty in comprehension. So he will not be able to comprehend what he's being told. So he will not understand and he will not follow the commands. So that kind of aphasia is called a sensory aphasia, or it is called as a Wernicke's aphasia in our neurological terms. There are different types of aphasia. There are around 8 types of aphasias, and these 2 are the common types of aphasias. And then there are other aphasias like transcortical motor aphasias, transcortical sensory aphasias, and there are primary progressive aphasias. The common conditions that causes aphasias are, the first and the most common condition is a brain stroke. So commonly brain stroke, a sudden insult to the brain, which may be in clotting or a bleeding into the brain, can lead to aphasia like a condition. So there are specific parts in the brain that are dedicated to language. Predominantly the left side of the brain is dominant for language. Some parts are also represented in the right half of the brain. But whenever there is an injury to the left brain, then the language disorder, the aphasia, tends to be more severe in intensity as compared to the right side of the disorder or the disease or the stroke. The second common condition in which an aphasia can manifest is a head injury. So a road traffic accident can also lead to that if we have a particular contusion in the language areas of the brain. And then there are other conditions which are rarer, like brain tumors. And the fourth conditions can be certain neurodegenerative disorders like dementia, can also lead to certain kind of aphasias. Primary progressive aphasia is a kind of a condition in which a neurodegenerative disease can lead to aphasia-like condition. So coming on to the treatment and the management part of aphasia. So the treatment of aphasia, first of all, is treating the condition. So what is the disorder that has led to this kind of a aphasia or a speech disorder? If it is the brain stroke, if it is a clotting, then we treat the patient with antiplatelets. If it is the bleeding or hemorrhage into the brain, then we have to control the cause of the bleeding of the brain. If it is the road traffic accident, whatever the cause of the head injury is, we have to treat that. If it is a neurodegenerative process, if it is a brain tumor, we have to treat the particular disease leading to the aphasia. The second part of the treatment is the speech therapy or the speech rehabilitation part. So there are specifically speech therapists for this kind of a condition, where we actually treat the patient, tell him how to speak. We actually treat the patient how he has to start reading word by word. So everything is taught to the patient step by step with the help of speech therapist. And then of course, there are support groups that are available, and then of course there is communication between the doctor, the speech therapist, support groups, family support that makes the entire treatment plan for this treatment of aphasia condition for the patient. Thank you.
Well, I hope this helps. Don't forget to share it with your family and friends, and don't forget to stay healthy, stay safe.